All right. Good evening, everyone. My name is Woei, one of the IMU Chinese Medicines lecturer. I'm also the IMU alumni from the Chinese Medicines program. Please do not ask me which cohort I am because it will sort of reveal my age to everyone. But that doesn't matter anyway. I'm also one of the practitioners in the IMU Chinese Medicine Center. So my expertise basically it's in gynecology. So in short means I basically treat women diseases. So for example, sort of like delay menses, period pain, or to help in those couple who have difficulty in conceiving. Now, without further ado, today I'm going to share with you our talk, which is revealing the marvel of Chinese medicines, the past discoveries, as well as the future prospect. Today on the floor, we have Mr. Seng together with us. He is also IMU Chinese Medicines lecturer, as well as the alumni. So I will mainly talk about the past discovery, debunk some of the misconceptions to everyone, and then Mr. Seng will further talk about the future prospect. So before we start, here are some of the housekeeping rules. So we have basically muted the microphones for all attendees, all right? So for questions and feedback, please use the Q&A panel so that we will answer to you, attend to your questions later after we finish the talk. And this live webinar will be recorded. Right. Chinese medicines is actually one of the most comprehensive and most widely used traditional medical system in the world. So there are many different traditional medical systems in the world. For example, like for instance, Malay medicines, Indian medicines, or Ayurvedic. Now, Chinese medicines is definitely one of the most comprehensive ones, and it has been widely used. Now, the most influential period of Chinese medical transitions was during the Han Dynasty. So during that times, all the natural law was conceptualized into yin and yang and 5 elements. So basically, they use all these informations to explain about health and diseases. Now, I believe to those on the floor, probably you don't have much understanding about what is yin and yang and things like that. Just to give everyone a few example, ancient times, how our ancestor actually comes into the understanding of Chinese medicines and form into a medical system. Basically, it's through observation. A simple example is that when you see the sun rise, right? So the sun does give us, the feelings of warmth. It gives us the brightness. So it's actually categorized into yang. When sun goes down, so basically, quiet. At the ancient times, you don't even have electricity like nowadays. So you are going to see that it is getting colder, you see quiet, peacefulness, all these things will categorize into yin. So I believe when I explain this to those who don't have much understanding about Chinese medicines, you will probably feel that it is very strange, isn't it? So, of course, originally Chinese medicine seems to be very strange, a very strange context to most of us, and especially to the Western context as well. Of course, due to the language barrier, and of course, due to the different practice from Chinese medicines, there are a lot of misconceptions. So not to mention that because the language that most of the times that we use, it's actually Chinese. So the language barrier has actually made it very difficult for people to understand it. So overcome the language barrier can actually make people understand how Chinese medicines work. Since there are so many misconceptions, so today I will basically share a few misconceptions to everyone. Hopefully after the presentation, you get more understanding about Chinese medicines before I hand on to Mr. Seng about future prospect of Chinese medicines in Malaysia. Now, Chinese medicines only suit the elderly. So hopefully I don't look very old here because as one of the people who use Chinese medicines, even though I'm a Chinese medicines practitioner, I do use Chinese medicines to treat my, small illness, sicknesses, and things like that. Chinese medicine's approach to sickness and illnesses basically focus more on enhancing the body. So it is commonly perceived as it is suitable for elderly only, but actually Chinese medicine is applicable to a wide range of health conditions, and it is suitable for individuals of all age. And there are many different set of treatment principle or treatment modality that we use. For example, acupuncture, cupping, herbal medicines, gua sha. So there are many different types of treatment method that we can use in order to adapt to various patients' needs. So not to mention that it is actually just limited to specific age group. Now, the picture that I'm showing here, not to ask everyone to look at the muscles and things like that, but basically just to show everyone, this is one of the athletes that presented in the Olympic, not the recent Olympic, but it is the 2021. So not to show everyone about the muscles, but it's just to let everyone see on the cupping mark. So during that time, it has actually brings an amazing response to the public that cupping, it's actually one of the treatment for the athletes. So in fact, many sport players turns out to acupuncture and cupping treatments in order to optimize their performance and also to improve their body natural healing processes. So by looking at the picture itself, I believe everyone start to question yourself. Now it has become a questions mark. Chinese medicines only suit the elderly. The picture here, another picture, just to show everyone, the late Kobe Bryant, one of the famous NBA players. So back in 2013, he actually posted a tweet on Twitter saying that he is actually receiving acupuncture treatment, right? So I believe putting up all this picture has already answered, the questions in your mind, or already have debunked the misconceptions that no, Chinese medicines actually suit everyone. It is not just for elderly people. However, Chinese medicines believe that individual has a unique body constitution. So consult a professional Chinese medicines practitioner to understand that which treatments are actually most suitable for you. It's actually very, very important. Now, talk about elderly, then the second misconceptions that will come in. Basically, it's only elderly Chinese medicines practitioners are reliable. As one of the Chinese medicines practitioner here, I hope I doesn't look old. But anyway, the picture that I provided here, it's actually Prof. Zhou, one of our professor in the Chinese medicines department. He is very experienced, obviously. He looks very experienced, all right? So therefore, it is always to the publics that for elderly practitioner, only experience, only reliable. But in fact, I'm going to show you another picture. So these are our groups of alumni who has just graduated back in June this year. So due to time constraint, I won't be able to explain the background of them one by one. However, I can tell everyone that most of them has graduated and they have secured a job. Some of them even secured a job right before they graduate. Even before they graduate, they already have company, they already have clinic that's invited them to be the practitioner at the site. So then it again becomes another question. Only elderly Chinese medicines practitioners are reliable. In fact, the reliability and the competence level in Chinese medicines come from the rigorous education, the ongoing training, as well as the certification, rather than just the age itself. Obviously, when we look at the picture here, they don't look old. However, the training, the education has actually made them experienced. So I can probably tell everyone that no, not only elderly Chinese medicines practitioners are reliable. The IMU Chinese medicines program has actually designed from easy to difficult, and we promote the integration of Chinese medicines and Western medicines, the conventional medicines. Now, if you look at the picture that I attached here, at phase 1, basically we start from theoretical studies. So as we mentioned, the integration of Chinese medicines and conventional medicines, obviously you need to have a lot of theoretical studies. So basically you go through, the basic Chinese medicines understanding, the basic Western medicines understanding, the cell biology, and things like that. After you've gone through a theoretical studies, then you move on into phase 2. When you come to phase 2, it is more on the simulated ward practical. So what we mean simulated ward practical is that we are going to put you into a simulated conditions, meaning they are not real patients, they are not having the real sickness. However, they pretend themselves that they are having it. So what is the benefit of having simulated practice is that we will put you into practice So no matter how many times, you can have multiple times on practice on a simulated patient in the simulated scenario. When you gain sufficient skill, when you have competence level, then we will only put you into phase 3, where it is the clinical internship and student clinic. Now, IMU has its students clinic. As the name suggested, we will basically allow our students to practice on real patients, obviously, after they have gone through the simulated ward practical. So the simulated ward practical has allowed them to gain sufficient practice before they actually faces the real patient. Of course, in the student clinic, it will be supervised by all the supervised by all the lecturer. And for the clinical internship, we will also allow the students, either they go to China or they stay within Malaysia, and for them to actually look at the practice out of IMU, and they will then bring back the knowledge they have learned and put into the student clinic for practice. So the set of arrangement, the set of training, the set of programs itself, it's actually designed from very easy one and then go on into the difficult one. And it will allow students to have more times to hands-on and practice. So I believe when I'm showing these progressions, yeah, you will definitely tell me after the presentations, saying that no, not only elderly Chinese medicines practitioners are reliable. In fact, it is all coming from the practice, the ongoing training, as well as the education. Now, the next common misconception is Chinese medicines is only for people from Chinese ethnicity. I believe this is the very, very common misconception. As the name suggested, Chinese medicines, right? So the words Chinese itself has actually bring misconceptions to people that it is only for people from Chinese ethnicity. So it could be, the misconception could be arise from, you know, the cultural specificity of the Chinese medicines practice, the Chinese philosophy, the language barrier, as the language that we use most of the times. Traditionally, it's Mandarin. And it is also due to lack of awareness about the global application. Now, I'm going to show you another picture just to prove that Chinese medicines is not only for people from the Chinese ethnicity. Now, the picture that I provided here is basically our alumni, our IMU Chinese Medicines alumni, all right? So in fact, many non-Chinese people actually seek out for Chinese medicines practitioner for various health issues. For example, pain management, for example, fertility issue, and things like that. So even though Chinese medicines had its roots in China, there are many people of all ethnicity have practiced it all over the world, and same goes to our alumni. So some of them currently is practiced for acupuncture for cosmetic, improve on skin issue, and some of them is actually improve on fertility rate for couple who have challenges in receiving. Some of them are actually practicing general medicines. They provide acupuncture, they provide cupping, and they provide herbal medicines to the customer. So even though Chinese medicines, it's rooted in China, but doesn't mean that it is only for people from Chinese ethnicity. Look at how well our alumni has actually performed. They have gained sufficient experience. They are also providing service to the public. Now, I believe the next questions from the floor definitely is, how are they going to study Chinese medicines? It's going to be difficult, isn't it? As we mentioned earlier, the language barrier, you know, the difficulty, the challenges, you know, when they learn Chinese medicines. So I'm going to show you a series of books, and just to share with everyone, there are many English translations book and resources for Chinese medicines that is available for studies. And all these reference book and resources, it's also available on the what we so-called e-learning portals for our students as a reference. So if you look at the picture, we have English translation books for acupuncture, for materia medica, which is the Chinese medicines, the herbs. And then we have the tongue diagnosis, we have the gynecology, and then we do have one of the famous classic literature book, which is the Yellow Emperor Classic of Internal Medicines. So all of them are actually accessible, and with the English translation is actually make it easier for the global audience to understand Chinese medicines. In fact, Chinese medicines, definitely, it's not just for people from Chinese ethnicity. It is actually for the world, as long as we break the language barrier. I believe I have resolved the questions. Now let's move on into the fourth one, which is acupuncture is only effective in treating pain. Now, this is the common misconceptions from the floor. So the previous three misconceptions, we talk about Chinese ethnicity, we talk about, for elderly people. So now we're going to talk more about the treatment itself. Chinese medicines is only effective in treating pain, obviously. When you look at the picture that I show here, I think you already have an answer in your mind, right? Now, this is a picture to show a cosmetic acupuncture. So I believe the effectiveness of acupuncture in treating pain, it is so well known because it has created an impression that the effectiveness, it's limited to the treatment of trauma, physical injury only. But in fact, acupuncture can actually do more. It can actually do beyond just treating the pain. Now, I'm going to put up certain research paper, which is published on the PubMed, one of the databases, just to show everyone acupuncture has more benefits than just relieving the pain or treating the pain. So the picture that I put up for the first one, acupuncture for cancer-related condition. Now, I believe this is quite common to the public because most of the times when people undergo certain treatment for cancer, so there are a lot of side effects, for example, vomit, nausea, the discomfort, the GIT system. So acupuncture can definitely help to improve the cancer-related condition. And overall, it is also quite common that acupuncture can help for infertile women who undergo in vitro fertilization and embryo transfer. Now, basically, in vitro fertilization, in short, it means IVF. So basically, those couples who have difficulty in conceiving, they are going to use a method to take out the egg from the womb, and they use the sperm and they culture it outside from the womb, and they're going to place it back. So acupuncture has an amazing result in helping this infertile woman. Now, it is still quite common when we mention acupuncture can help for infertile women. Now, I'm going to put up the next one. The efficacy in helping male infertility, it's also very, very common nowadays. So acupuncture, if you look at the paper that I put up, obviously it has more effect than just treating the pain itself. Not to mention that it can also help in depression. Due to time constraint, I won't be able to show you all the research paper over here, but I believe this few one has already break your misconception that acupuncture is not just effective in treating pain. In fact, it can boost fertility, it can improve insomnia, it can improve digestion, it can also aid in weight loss, benefit the skin, as the picture that we shown earlier. So acupuncture definitely has way more benefit than just relieving the pain itself. Now, after we finish talking about acupuncture is not only effective in pain, I believe when I show the picture, about the cosmetic picture just now, everyone probably in your mind will start to screaming, especially for those who never experienced acupuncture before. You're going to say, ouch, acupuncture hurts, right? Yes, most of us do associate needles with pain because, needle poking through sounds very scary. It sounds very painful enough. Some of us even experience fainting, when you go and draw blood for your blood examination, your body check. But in essence, the needles, the acupuncture needles, is actually as fine as a strand of hair. Now, I'm going to put up another picture just to show everyone, how fine it's an acupuncture needle. How tiny is it? Now, if you look at the picture here, generally, an acupuncture needle tends to range from 0.16 to 0.3 mm. All right. And if you look at the medical syringe, compared to medical syringe or a hypodermic needle, which tends to be about 3 millimeter, it is 10 times thicker than an acupuncture needle. So out of your surprise, if you are able to bear with the pain from the medical syringe, obviously you are able to bear with the pain from the acupuncture needle. Of course, just kidding. Everyone have different pain tolerance level. everyone's have different sensitivity as well. So it is really depends on individual whether you find it acupuncture hurts or not. However, if you look at the fact here, acupuncture needle, it's really thin, which is 10 times smaller than a medical syringe. And as we mentioned earlier, the training itself, the ongoing training, the simulated conditions that we provided to our students has actually made them experienced in performing acupuncture. So a skillful acupuncturist, a skillful practitioner will definitely know how to reduce the pain when they do acupuncture. So therefore, that is less worried for this part. However, the sentences that I put up here is just acupuncture only hurts sometimes because it really depends on individual. Last but not least, I'm going to just briefly explain about this very, very common misconception, which is there is no research or evidence behind it. Now, this is the very, very common misconceptions that we heard from the floor, from the public. All right. Actually, all medicines, the ultimate goal is to relieve the symptoms, it's to treat the sickness, it's to cure the sickness, and to improve the life quality of the patients. At the beginning, Chinese medicines and Western medicines are actually at the same point. However, from time to time, due to the different development in different country, and then the progressions, the government policy. So now Western medicines focuses more on statistic, where they look at those tiny, tiny things under the microscope. For example, the cell, for example, the DNA and things like that. While Chinese medicine still stay at its origin, which is way more traditional, and we are focuses more on experiential, and we do not work within the lab most of the time. How the approaches to the human body are very, very different for both Chinese medicines and Western medicines. So the earliest transitions of Chinese medicines were actually linked to the belief in the ancestor. So they have actually experienced a trial and error system of the development. So remember, we mentioned just now how they actually come up with the medical system itself at the very, very beginning. A very simple way to explain to everyone here who don't have much understanding about Chinese medicines is that they just, through observations, and then they collect the informations, and then they make it down into a medical system. When it's come to treatment, so it's like a trial and error system. So when they taste these medicines and they realize that, oh, its taste is bitter, and it can help to improve these symptoms, then they taste it again, then they record it down again. So it's all gone through by a trial and error system. And they accumulate all the informations, and then they form it into a medical system. I believe when I explain this again, it brings a lot of worried, in the public, in the floor, when we explain about how Chinese medicines were formed at the beginning. So obviously, Chinese medicines has improved from 2,000 or 3,000 years ago up until today. And it is actually just the way of practicing it. It's different. And we also understand that as a Chinese medicines practitioner, we understand that to translate the Chinese medicines language into modern medical language would actually help to validate the effectiveness. We are practiced from different perspectives. Doesn't mean that we are not having any evidence behind it. It's just that the way of practicing it is different. And we do understand that to translate Chinese medicine's language into the modern medical language will help everyone to understand its effectiveness. So therefore, there are many research has been done. For example, the picture that I show on the right side, showing and research trying to do or trying to explain how Chinese medicine herbs work. So basically, they are trying to find out the protein in the herbs itself, and they're going to see how this protein work in specific pathway in our human body to a specific diseases. So if you look at the progresses, I'm not going to take time to explain the complicated progress. However, in instant, when researcher able to come up with the result, and it is in another way to show public that Chinese medicines work in such a way, right? We put it into a modern language and it will help everyone to understand it. Now, I just want to I'll emphasize again, Chinese medicines and Western medicines are all the same. Our ultimate goal is to relieve symptoms, it's to cure diseases, and there are many research has been done. So there are research and evidence behind Chinese medicines, of course, not to mention the research paper that I put up earlier to explain about acupuncture, not just in treating the pain. So there are many research and evidence behind it. However, due to lack of awareness, so it is definitely the part that we have to improve on it. Now, when I comes to this point, I believe I've cleared some of the misconceptions for the floor, and probably you have more questions in your mind. For example, when we explained the misconception just now, you will probably start to think about, what if I study in IMU? Is my cert issued by IMU allowed me to practice overseas? Probably you have another questions. Is Chinese medicines regulated in Malaysia? You know, these are also certain common misconceptions that due to time constraint, I won't be able to explain one by one. However, I'm going to hand it to Mr. Seng. I'm going to pass it to Mr. Seng, who will explain the future perspective, and he's going to touch on this point and have a clearer explanations to everyone. So hopefully after my presentations, everyone's now has cleared some of the doubts in your mind and have more understanding about Chinese medicines. Now, without further ado, I'm going to pass my time to Mr. Seng. Over to you, Mr. Seng.
Hey, hello. Hi, Miss Go. Right, so thank you, Miss Go. And do allow me to share my screen first. Right, I think you should be able to see my screen. If you're not able to, then you can either put it in the chat and things like that. But thank you for Miss Go for her very informative and very interesting talk earlier to try to debunk certain issues that we have always encountered in Chinese medicine. So over to my side, what we will do now is we want to find out more about what has Chinese medicine been in Malaysia. So of course, I think many people would have certain doubts, for example, like what have Ms. Goh mentioned earlier, for example, Chinese medicine has to be learned by only Chinese, right? Or only Chinese can use it and things like that. But those are not the truth, you see. Chinese medicine is a type of medicine, right? Why they call it Chinese medicine? Very likely because they just want to differentiate it from a different kind of medicine. And this medicine came from China, right? So therefore they call it Chinese medicine. But if you put it on a bigger perspective, it's also a type of medicine. So the overall rule over here about medicine is to help people, right? Be it it's modern medicine, be it is Chinese medicine, be it is Indian medicine. Those are just medicine. You have to take it as its experience and also the thoughts that were accumulated over time by our ancestors, and probably now which are our time to actually use this kind of experience and find out more things, right? So medicine is a field that can always innovate, right? So our role today, mainly, if you were to step into Chinese medicine one day, who knows, you're going to study Chinese medicine, right? If you're going to do that, be proud of yourself because you are also part of the medicine field. That's what I'm trying to say, right? But don't get me wrong. What I'm trying to say here is that you are there with a mission to try to help people, right? Hopefully that gives you some encouragement and also know that actually being as either a Chinese medicine, you are not that bad or you are on a second class or things like that. It's not, right? Everyone in the healthcare field are on the same level, right? Our role is to help people, right? So over on my side today, what we are going to do is that we want to talk more about what's happening in Malaysia, right? What are the opportunities that you can tap on and how's the growth in this particular healthcare sector in Malaysia, especially for Chinese medicine, right? So for today, what we're going to cover here is number one, we talk about an introduction to Chinese medicine. I won't spend a lot of time here because I think Ms. Goh has mentioned quite a bit there, right? But I think today we want to focus about how Chinese medicine has evolved in Malaysia. How does it come in? And what is the current status of Chinese medicine in Malaysia? And another thing here probably that could interest you could be the potential opportunities and challenges that we are facing in Malaysia. And I think that would be a very important part, whether would you want to be in this field or not. You see, when you want to choose what to study, of course, very importantly is your interest. Because why? If you are in this field, you will take this particular profession for some time, right? It could be 10, 20 years until the day you retire, you see. So it's very important that you have interest in this field so that you can go longer, right? That's the thing of it. But another thing here is that even if you have interest, is there a field for you or not? Is there a, a place for you to showcase your potential or not? And to be very honest with you, if you decided to come to Chinese medicine, what we can tell you is that the future here is pretty good. It's not that bad. What I'm trying to say is that government has been pushing certain policies, trying to regulate it, but definitely it requires some time, right? So from my time when I studied, right, when I studied, those days they were talking about regulating the laws and things like that. Those days we will keep on questioning them, when are you going to enforce the laws and things like that. But today, I can tell you that the law has already passed, it's enforcing, right? We will go through that in the slides later. So those are advancements. It might take some time, but we believe that by the time, if you join us, let's say this year, next year, or let's say in the 3 to 5 years time, when you graduate, I believe that the healthcare sector would change, right? Chinese medicine will play a role in it, but how extensive is the role, then we will have to look at it, right? So if you're interested and if you are thinking that, do I have a future if I do in this field? I can tell you the field is big. There's a lot of potential in it. There's a lot of money in it. As in, there's a lot of market in it, right? So whether you know how to tap on the market and make a fortune out yourself, then that's up to you to go and take, right? Right. So that's what I'm trying to highlight over here, right? Another thing, probably the last part here is on the career pathway in Chinese medicine. So this part we will emphasize a bit that what you can do and where is the goal in Chinese medicine in the healthcare field, right? So let's move on to introduction to Chinese medicine. I think we have mentioned it a bit also. Chinese medicine is a type of medicine, but it's originated from China. It's originated from China and it has almost over 2,000 years of history, right? So you could think that you are trying to learn what has been accumulated by your ancestors, right? By all our ancestors, right? So we are here to try to see what they have documented. Was it applicable to nowadays, or would we have to tweak a bit and change things, right? So you just have to think in a way is that today, let's say, why do you learn from someone? Because they have experience, right? So similarly, we are doing the same thing, but we're learning from our ancestors through what they record down, right? So because as human, we cannot live forever, right? So we only can document our experience down and it pass it to the next generation, and everyone do more research or let's say experience on it and tap on it. So with 2,000 years of history, what we can say is that there is definitely a good amount of knowledge, right, that has been accumulated. And now is the time that we want to see if all this would make sense in today's context, right? So some of the practices that have been done in Chinese medicine includes Chinese herbal medicine, acupuncture, cupping, tuina, and guasa. Of course, there are more, for example, like bone manipulation and all, right? So regardless of which, right, if you study Chinese medicine, very likely you should know all of them, right? Unless you are going for a very specialized course, let's say diploma in acupuncture, then probably you will be in the acupuncture field. But of course, most programs nowadays, regardless is and whether IMU or other universities, you should be learning everything, right? So when you graduate, then it's time for you to think: do you want to practice all, or do you want to specialize in one of it? So that is on specialization, right? But anyway, if we talk about the evolution of Chinese medicine in Malaysia, right? So we can always look at this as in the 18th century, when actually the British were in Malaya, there was some influx of Chinese immigrant into Malaysia. And why is that so? Is because there was a time where they want to use certain raw materials in Malaysia, right? So therefore, they try to get people, let's say from India, they get people from China, they came right? They came to Malaya. And of course, these people, let's say from China, some of them, they may know a bit here and there on certain knowledge of Chinese medicine, right? So those days, TCM was here to address the health needs of the Chinese community. And why is that so? Is because usually is you have some sort of emotionally attached back to your own race, lah, right? Usually it's like that, right? So same thing. So the Chinese community, when they were here, right, they get emotionally more attached back to Chinese medicine because that was something that they were familiar with, right? And of course, during those days, the British colonial government will require these Chinese immigrants for here for tin mining. And when people get sick, and we have to understand that during those days, in Malaya, the healthcare system wasn't very developed. So there wasn't really like big hospitals or things like that. So when you are sick, what you can do is you look for help, right? And if you're not familiar with, let's say, the Malay medicine and things like that, what do? You go back to your own people, your own group of people, and see if they have any idea to treat you. So those days, the rich Chinese merchant, what they do is that they set up charity clinics, right? And they get TCM practitioners from China come to Malaya, right, to treat their own race in that sense during those times, right? So many of things in Malaysia, as you can see, for example, one of the brands, let's say Ho Yan Ho, I'm not sure if you know the brand. The brand basically is founded in Malaysia, but then the person who actually invented this thing was from China, right? He came to Malaya, and the same thing happened, right? So those are one of the examples that why Chinese medicine came in. So Chinese medicine came in through this way, right? So as we move on to the 1900s, right? So what you see here is that there was some sort of TCM associations that has been established. So some of it, for example, the Woei Chinese Medicine Institute, right? And for example, the Singapore Chinese Medical Society and things like that. Although this society eventually became the current Singapore Chinese Medicine Association, right? But those days, Malaya includes Singapore, right? So those were the early ones. And until today, we have three main ones, which are part of, one of it is the Federation of Chinese Physicians and Medicine Dealers Association of Malaysia. One is the Malaysia Chinese Medicine Association. Another one is the Federation of Chinese Physician and Acupuncturist Association of Malaysia. So these three are currently the ones that host most of the Chinese medicine practitioner, right? So before the act come into place in 2016, these were the associations that has mostly their members are traditional practitioners, right? Chinese practitioners. So until today, these associations are still there, but it's an optional for you to join these associations, right? But anyway, it's good that you know there are such associations. And one of the association is part of the TNCM Council at the moment. There's a council that governs us, right? So one of it is actually a representative for us in the council. So moving on, what we have here was that in the 2000 years, in the millennial years after that, Malaysia has gained independence. And of course, at this particular time, there was some sort of interest in traditional and complementary medicine. So traditional Chinese medicine itself is part of a traditional and complementary medicine. And the standing committee was formed in 1998, right? And in 2000, there was a TNCM national policy, right? And in 2004, the TNCM division, which is called as the Traditional and Complementary Medicine, was established in the Ministry of Health, right? So at the moment, this division is still active. Most of the laws, most of our registration, and most of, let's say, the regulations and all is done by the TNCM division. So if one day you graduate, right, you want to practice in Malaysia, you need to get a license from the TNCM division, right? So if we move on some more, we talk about the current landscape of Chinese medicine in Malaysia. So remember we talk about the TNCM Council, right? So what does the council play a role in, right? A lot of people those days, let's say before the act was being enforced, what people do is that you go to somewhere where you think the person is licensed, then you take herbs from there. Then if you don't recover, you go to another shop. So those are the ways how we do it those days. And many of them, because those days before 2009, before 2009, Malaysia do not have really very official university that offers Chinese medicine programs. Those days, a lot of people, they either go to China and learn, or they learn from their ancestors, or they learn from some gurus or things like that, right? So those days, if you're good, that's the best. If you are not that good, but you act good, then that's a problem. Because if you're not good, but you act good, meaning that somehow you're like cheating people's money, right? Cheating people's money is one thing, but another thing is that you might make the person worse and the person might die, right? So that's the problem with that. And therefore, a lot of times, why until today, there's still this perception that Chinese medicine is poisonous, is bad, and patients should not take it, for example, when you have taking conventional medicine or modern medicine, right? We won't say that, oh, you should mix them together. It's not that way, right? But it's not all Chinese medicine would have that effect, right? So that is something that we need to clear. But before that, because those days, there's no official training for certain people. Therefore, the reliability of all the practitioners were being doubted, right? So if that happened, then it's very hard for us or to be in the healthcare in Malaysia, in the mainstream healthcare in Malaysia, because there's no trust, there's no governance, there's no quality control, right? So therefore, today, we have the Traditional and Complementary Medicine Council, and what they do is that they have put up a recognized practice areas, and that includes traditional Malay medicine, Chinese medicine, Indian medicine, chiropractic, homeopathy, Islamic medicine, and also osteopathy. So these 7 covers under TNCM, right? And of course, for ourselves, what happens is that we fall under traditional Chinese medicine, right? So if you graduate with a certificate from an official university that's being recognized, you will be registered under traditional Chinese medicine, right? Under the TNCM Council, right? So next on is the regulation, right? So when we talk about the regulation, we talk about the law, right? So we have the TNCM law, TNCM Act 2016, and this act was officially gazetted in 10 March 2016 and came to effect in 1st August 2016. So this is actually a law. You can go and search this law. You can go and look at it in the internet. You can just look for Act 775 Malaysia, then the thing will be there, right? You can read them, but I don't think you want to read them. It's very boring, right? So this thing is to set a TNCM practice and practitioner legal framework so that at least we are being recognized in one way. The quality is being assured. That's one thing. Another thing is that if anyone want to sue us for any misconduct or anything, then the law would protect us in certain manners, right? So this act itself is to regulate the TNCM practitioners. Another thing is that here is to maintain and make sure that the quality of the practitioners are there. That's number one. Number two is that if we can maintain that, then we can somehow assure the safety and quality of these people, of these practitioners, right? To raise public's confidence in terms of us. If we cannot raise the public's confidence, it won't say we don't have customers or don't have patients. It's not like that. It's just that it's very hard for us to push forward for development and also collaborations with other medicine, right? So another thing here is to protect the public from unqualified practitioners and unsafe practices, right? So over here, right? So on here, you will see that because we assured the quality, so therefore we can protect the public from unqualified practitioners. So today, if you are going to a practitioner clinic, TCM clinic, it's nothing wrong if you ask to look for their annual practicing certificate from the Ministry of Health. You can always ask for that. Because if they don't have, then at the moment, they are not qualified in that manner in Malaysia. They are not licensed. They cannot practice, right? So that's something that you can go and ask, right? If you don't think you're comfortable with the practitioner, you are not sure, all right? You can always ask for it, right? So another thing here is the APC. So the annual practicing certificate looks like that, right? So everyone who graduated should go and register with the council, right? So this act itself is that the practitioner must possess the necessary qualification, training, or experience. So most of us that we graduate from official universities, let's say, be it from China or be it from recognized universities in Malaysia, you have to have, you would have the necessary qualifications. You just need to submit and get this paper, right? So this actually mine is expiring soon in I think August 20 something. I need to renew also, or else I will be not licensed, right? So I have to do it as well, right? So every year you got to do it, right? So with this particular paper, it somehow assure that you have the necessary qualifications. But does that mean that it's guaranteed that you won't cause problems to patients? That's not guaranteed, lah, right? Just that if you get the cert, then likelihood is that you are educated in that sense. But if you cause problems because of your misconduct, then that's a different story, right? But at least with proper qualification, we reduce the risk of getting that issue, right? So next up is the council. So the TNCM council itself is this council was established under the Act 775, and this council is responsible to do all this, right? To register TNCM practitioners and issue certificate of practice. You don't know them, also never mind, right? It doesn't matter. This as long as you need the cert, you submit to them, then they will go through, then they will give it to you. So the point here is more of today, we want to tell you that the act is there, right? So we are regulated, and most of us, we are qualified, right? So this thing is there to raise public's confidence on traditional medicine, right? Next thing here is about the enforcement of the act. So currently we are in phase 3, right? So since the first phase in August 2016, we set up the 7 practice areas. And in 2021, what happened is that we start registration. So some people may ask, there were some old practitioners, they didn't go to school, they didn't go to uni, they learned from one of the guru or sifu. So what happens? These people, if they have enough experience, they can still register. However, there is a particular grace period that they have to do it by 28 February 2025. So by February 2025, if you don't have the cert, you can be charged, right? You can be charged under the law. That means you don't have license and you practice, right? So this is just an update for anyone who wants to know. All right. So anyone who practice should have the APC, right? So besides that, there are some initiatives that has been taken by the TNCM division. So just to very quickly go through is these are more related to the Chinese medicine. For example, there is collaboration with China, right? They hire those Chinese experts over, then they discuss and see what can Malaysia do better in terms of research, right? And also they launch certain frameworks, research frameworks, and also they launch certain guidelines for the healthcare facilities on how to manage better in terms of quality and governance, right? So in terms of one of the guidelines here, right? So this is the TNCM medicine, TNCM blueprint from 2018 to 2027. It focuses on 4 areas: clinical practice, education and training, products, and also research. Remember these 4 things now. In Chinese medicine, right, in Malaysia, no matter what we do, it eventually comes back to these 4 things. Either you go out and practice, or you teach, right? Or you do further training, right? Or you want to come up with products, or you do research. These are the 4 things, right? No matter later when we talk about the career part, it's also these 4 things, right? So this particular blueprint itself, it can be found available online as well. It detailed out what should be done by 2027, right? So of course, each part has its own emphasis, right? If you are interested, you can read out, right? Besides that, there's also this framework on TNCM research in Malaysia. This was published last year. And of course, these are the 4 framework again, in terms of education, practice, and practitioners, research, and also products. So as an education institution in IMU itself, we park under here. We park under practice and also, we park under education with training. We are there to provide that education and train any of you who eventually come into IMU, right? And we make sure that you are competent enough and go for practice, right? So the act itself also governs these few things. The initiative by the government also goes around these few things, right? So in terms of research, later we can show you a bit, especially, I think Ms. Goh mentioned a bit of research as well, but of course, we cannot go in dive deep a lot. But then if you look at research in Malaysia in terms of TNCM, it's very little as compared to the other medicine. One thing here is it wasn't perceived as important. That's number one. Another thing was a problem was that there wasn't enough knowledge to do it, right? So this guideline was there to actually come up with a framework to guide people to do it. Even you have no knowledge, by reading the framework, you should have some idea, right? That's the whole idea of why we have this framework, right? Another thing here is on the guideline of herbal medicine research. Basically, this was published last year as well. And this was actually one of the chart that was mentioned in it that whether Chinese medicine, should it be actually a therapeutic claim kind of medicine or not, right? Because if you claim there is therapeutic claim, which most of the time we do have, but then it has to go through a very stringent process, right? Because research is not that simple, right? It has to go through different type of experiments, right? So we're not going to elaborate on that, but this guideline, in short, is mainly for herbal medicine. So what I'm trying to come out totally with you in a nutshell, if you don't get any of these, right, one thing that you must get here is that government is putting initiative on developing traditional and Chinese medicine in a traditional and complementary medicine in Malaysia. When they put effort, they pull in resources. That means this field will happen or things will happen in 10, 20 years. Something will happen, right? So as long as people put in effort and resource, this thing will grow, right? So if you're interested and you think that this field got no hope, then if you talk about 10 years ago, no hope, maybe yeah, the hope wasn't so bright. But now, if you're talking about hope, government put a lot of effort there, right? So another thing here in terms of registered practitioners, in Malaysia, we mentioned that in 2021 we started that particular registration, right? So those days, the registered participants in terms of TCM was 1,500, almost 1,500. And in last year, there was new application of close to 1,900. So if you can look at the chart, maybe you cannot see all the rest, but the rest, the colors, right, are the different kind of recognized practice areas. Chinese medicine still holds the biggest amount, and you can always see that it's the biggest one. We have close to about almost 60 to 70% of TNCM registered ones are traditional Chinese medicine. So this field is very regulated. Education is there. A lot of structures are being done, right? And there is a lot of potential in it because China is also doing very well. So a lot of time when China brings up the whole thing, people look at it and see, hey, there is actually future to it. Then Malaysia can tap on it. Therefore, Malaysia always look for China for help to come in, to put in certain frameworks and things like that, and we follow. So China went through that. Today, 2024, in terms of Chinese medicine, China was about, let's say, the 19 somethings. So China went through the regulation period. China went through the integration period. Malaysia now is going, Malaysia always a bit slow. Because one thing, Malaysia needs some reference. So now you can refer to China. How China do it 30, 40 years ago, now we are doing it. So imagine in 30, 40 years, will we go to integrative medicine? It could happen, right? Because the model is there. So you just have to follow. But how fast can we come out or duplicate with this model? It requires time. Because it requires effort. It requires us, whoever, if you graduate as a Chinese medicine practitioner, you put in effort and build that particular field, right? So this project will take some time, but eventually you will see a bright side at the end, right? Okay. Another thing here, very quickly to go through with you is, if you're saying that, hey, government got Chinese medicine actually got in about 15 public hospitals in Malaysia, they do have Chinese medicine or what we call the TNCM unit, right? So if you look at the red ones, right, you don't have to go through very detailed, but if you go at the red ones are related to Chinese medicine, either as acupuncture or herbal medicine as an adjunct therapy, right? So the blue one is mainly Malay medicine, traditional massage is Malay medicine. The green one is the Indian medicine one, right? So you can see, right, most of them, I would say all of them, right, except Hospital Sungai Buloh, got Chinese medicine related things in it, right? So if one day you feel like I want to go to public hospital and work, you can, and you can work in these units, right? And we expect that the units will grow more, right? The latest one is actually Selayang, right? And Selayang actually do work with us a bit as well, right? So it's newly established, and one of the person who established this thing was from IMU as well. He was a master acupuncture from us, right? So this is what the government trying to do, right? So you could see that over many years, over 10 over years, it has grown to about 15, and we expect that it will go up more, right? So government is putting initiative on it, right? They are trying to do more research on it to prove that actually these things should be integrated to help patients better, right? So in private sector, for example, in IMU, right, like our IMU Chinese Medicine Center is established 2010, right, and we provide outpatient consultation and treatment, and that includes these kind of treatments as well, right? And the IMU Chinese Medicine Center will act as a clinical base for our final year students. So if any of you were to study in IMU, right, the 5 years program, the final year, you will have at least half a year to really practice on real patients, all right? The patients, usually you will have to entertain the patient, right? And you go from top to bottom, A to Z, from how you diagnose, how you treat the patient, right? At the end, and everything is done in IMU, right? So at least before you graduate, you get that opportunity to try, right? How to treat your patients, right? And that builds your confidence, right? So that's one of example in the private sector. But if we talk about other private sector, for example, like Dongxin, we talk about Woei Hospital in Penang, right? Even nowadays, you might be seeing that after COVID, there's a lot of Chinese medicine centers actually came up. For example, like Sunway, Thomson, even Yuanshan, there are even more. But these ones I purposely pick it here is because these are actually big boys. Big boys means that they are actually from some big corporations. They are putting money and try to build, or they try to do Chinese medicine related kind of business because they see that potential. If the big boy can see it, you should see it. That's what I'm trying to say, right? Because they see that part can make money. Okay. But of course, making money is not the main aim why we study, right? It's more of an interest and more of you want to treat people. But if you're talking the field got money in it because people put in money and the field will run, right? So therefore, this field is bright. That's what I'm trying to say. Next up, right, in terms of research papers, you can see that over years, right, it has increased quite drastically, right? But of course, this amount is not big, right? And it has to put more effort in terms of research so that we can actually make it into a good amount of research papers by 2027, right? So if you look at this chart, we can see that this was one of a research that was done by our students. We try to tabulate, and we see that in the beginning, it was very little. It was less than 10. But as we move on, it came up more. And we believe that by after COVID, it would get on even more, right? So this part is on the current landscape of Chinese medicine in Malaysia, right? So in terms of market potential opportunities and challenges, right? So what you can see is that in the global wise, right? The global TCM market is very big. It's up in $1 billion US, and it has compounded at least 7.45% over time, right? And that is the global market, right? That includes China, Japan, and things like that, or even in US, right? But if you look back in Malaysia, the Malaysia T and CM industry, of course, we don't have the TCM related ones, but we have the whole T and CM one. It has been from about up to, I think, 4 billion. It is expected to go up to about 19 by 2027. So that actually also showcased that there is a lot of money is expected to go into this field. And I believe Chinese medicine will take one big part of it, right? So in terms of opportunities and also challenges, I think that because of rising healthcare costs, right, and also aging populations and also growing interest in natural therapies, especially after COVID, a lot of people tend to look for Chinese medicine, right? And with the current government support coming in, right? So when government support comes in, right, that shows that it's being regulated. And for your information, there's even some insurance company that offers actually you can actually claim, right, TCM related kind of actually therapies, right? So besides that, right, another thing that is coming in is actually the AI technology. I'm not sure if you know about AI so much, but AI has been helping a bit in terms of traditional medicine in order to learn traditional medicine better, right? So with AI coming in, we can see more precision kind of medicine, right? With that, right, I think this field with technology coming in, it's don't think that Chinese medicine is very traditional, that it is just everything just about skills, but skills are required. It's just that with technology, it can get better, right? So of course, the eventual plan here is to integrate with modern medicine, right? But of course, we do have certain challenges. For example, like regulation and standardization could be an issue at the moment. As in, if you learn Chinese medicine in the future, let's say, right, standardization sometimes could be an issue because not all patients, let's say with cough, can take the same medication because the theory of disease could be a bit different. So that part could be a problem, but it's not saying cannot be solved. It's just that probably it has to be understood in a different way to standardize it, right? Scientific validation was an issue, right? Was an issue because scientific validation likely is that because of different way of validating the science of it, right? And of course, another thing here is on competition. Competition likely is because of different medicine coming in, right? Therefore, this competition could be an issue to it, right? So moving on as a career pathway, I think we are approaching the end very soon now. But if you're looking at a career pathway, right, after you graduate as a degree, regardless which part of a degree, first, very straightforward, you be a practitioner. You go out, you either open your own shop or you work for other people. That's one way, right? Entrepreneur is the way that you work for your own self. Either way, if you don't want this way, then what you do is that you go for further study. If you go for further study, you can become a lecturer. You can become in the academic field. You can also do research if you want to, right? And of course, if you want to, you can become a clinical manager, right? So there are some people who choose that pathway, right? So of course, as we move on, you can go for specialty training, right? That would include your postgraduate training or a particular specialty training, for example, acupuncture, let's say bone manipulation, let's say certain herbal therapy and things like that, right? So these are the general pathways, and these pathways you can see are all supported by government in the sense that number one, they make sure that after education, you have enough of practice, right? That practice part they are regulating, research they are regulating, right? So it covers all part that the government wants to support, right? So therefore, if you say that, if your first question here is, do I have a job after I graduate? Confirm got job, right? Confirm got job because after COVID, a lot of people open their own shop, so they're hiring, especially around KL and Selangor region, right? So over here, this is actually the Chinese medicine in in IMU's kind of the way how we conduct it. It's a 5-year program. You can do it local or partner, right? And it's a 5 years one. For example, that I've said is 5 years. And in IMU, there's something special, which is the graduate training program, right? So if anyone has questions on that, we can answer that later. But I won't elaborate too much. But this thing, in a nutshell, it means that some universities that they let people do intern and then people secure a job when they're doing interning, especially like accountants or let's say those who study mass comm and things like that. In IMU, we are doing the same thing. We send you to our partners for internship, and if you're good enough, if the intern place boss like you, don't know, maybe your skill very, very good, they like you, right? So what happens is that they can give you an offer before you graduate, right? So with that, right, if you're good enough, you secure a job before you graduate, right? So I think that's something that makes IMU different from other people. And also another thing is on the early exposure in terms of practicum. So I think just now when we talk about IMU Chinese Medicine Center, we said that you would have that opportunity to actually practice on real patients in IMU, right? So basically these are the programs, right? So it has 10 semesters in total, right? And of course, last but not least here is where do our alumni come from, right? Mainly it's Malaysia, but we do have other places as well, right? And it goes up to Europe, but not a lot, okay? And our alumni, basically, after 6 months, right, we can see that most of them, they actually do either self-employed or they employed by other people, right? So there are one small group of people, actually, not actually one small group, about almost 40%. 40% of them would go and continue study. Continue study means that they do postgraduate. Either they do masters or PhD, right? Got people do that, right? So this is the current way in IMU, the graduates, that's the trend we are looking at, right? And of course, for those that go for study, most of them, they get scholarships from China government. So it is nice, you don't have to pay for it, right? When you get another master's. But of course, it's not that easy, the process, it has to do research and things like that. But this is the current trend, right? So if you're talking about work opportunities, there are a ton of it, right? And decide of yourself whether you want to further study or you want to straight work, right? So, okay, last but not least, okay, I'm ending the presentation very, very soon already. Okay, so if you're interested, right, you want to know about IMU Chinese medicine better, right? Our intake is always in February and September, right? So if today you're interested, you can always sign up for the September one, okay? But if you are not there to sign up, what do I mean by not there? Meaning that you're still doing, let's say, your SPM, right? You're not going to study this year because you don't have that necessary qualification, or you're doing your pre-U now. You cannot sign up now, right? If you want to experience it, come to us. On the 13th to 15th November 2024, we have our annual IMU CM week. Come to us. You can experience how Chinese medicine works, right? You can ask questions, you can feel the atmosphere, right? And this is one of our Instagram page in terms of the IUCN Club. You can always follow that, and you can see updates from there. And this is something that we've done last year, right? And this is this year's theme, right? So it's on 13 to 15 November, and it's from a Wednesday to Friday. Any day you can come, right? Just feel free to talk to any of us, or you don't have to come on purposely on this day. You can come on any day, and you look for admissions people and ask more about the program, right? But if you want to have a feel of how Chinese medicine is, how the treatment looks like, and how it is, come to this event. This is an annual event. All students and lecturers will participate. You would have plenty of experience that you can get from it, right? So I think that's all that I need to present in terms of my part. So if you have any questions, put in the Q&A. But these are references if you want to go and find out. But anyway, one more thing. Okay, on the 18th of August, which is this coming Sunday, okay, IMU has an open day. Okay, it's from 10 to 4. It's in our IMU Bukit Jalil campus, right? You can come to the campus, okay, you can park here, okay, and can experience and ask questions, right? But over here is more on inquiring, right? If you're ready to actually register, come here, you get a waiver, right? You will get a waiver. But if you're not ready, let's say you just want to ask more, you can always come as well, register your interest. Then anyway, if we have anything to do with Chinese medicine, we'll send to you, right? But if you want to experience about Chinese medicine more, then come to our Chinese medicine week. That would be better because you will have to do hands-on and things like that. But open day, likely we don't have that, but you can inquire during open day, right? Besides that, application waiver and registration on the open day is up to 800 ringgit, right? So you can always come to us and we will waive that particular part. So if you are ready to register, do come to us on the open day, because if you come on other days, we cannot waive that, right? And of course, if you're not very sure what to study, you can come to the open day as well. There is actually a career test for you. There's a career test for you, right? So besides that, over here, you can scan for more info in terms of the QR code. It will bring it to the open day, right? You can register interest there as well. And if you have any questions in terms of anything about any program IMU, you can go to www.imu.edu.my. And if you have any pressing inquiry, you want to email, you can always email to enquiry@imu.edu.my. All right. So I think that ends my presentation here. And I'll hand it back to Ms. Goh. So, Ms. Goh, back to you.
All right, thank you, Mr. Seng, for the very informative sharing. I think Mr. Seng has shared a lot in terms of the current landscape in Malaysia, the challenges, as well as the opportunities that I think it has triggered everyone's interest, whether they should sign up today, to join IMU Chinese Medicine programs. So that was a very informative session just now. Right. Thank you for those who have put up the questions in the Q&A panel. So I think it is time for us to answer those questions. So probably we'll go on to the first one first. Right, so the first question is, what is the difference of studying Chinese medicines in IMU comparing to studying Chinese medicines in other universities in Malaysia? So particularly in Malaysia. All right. I think I will take in these questions, all right, to answer this to the one who have actually raised this. Right. So IMU is actually the first and most established private medical and healthcare university with over 30 years of experience. All right. So in the past 30 years, we were mainly focusing on healthcare programs. Of course, now we have actually bring in more other programs. However, IMU still the first and most established private medical and healthcare university. So the IMU, it's also one of the few university in Malaysia that basically offer Chinese medicines in an English speaking environment. So our main language is basically in English. Our programs, it's delivered in English as well. And of course, it is supported with Mandarins when it is required. For example, we do have basic Mandarin classes to support those who keen to learn Mandarin, or for those who wish to actually study their master at China, like what Mr. Seng has mentioned just now. So we do have certain module that support with Mandarins. And IMU Chinese Medicines programs, it's also accepted by Australia and China for credits transfer. So both of these partner university that in Australia and China are actually part of our WHO Chinese Medicines Research Center network. All right. And not to mention that our programs also has a very strong Western science and medicines component. As you're probably aware, IMU has a lot of Western medicines programs, for example, like MBBS, like pharmacy, those are the well-established programs in IMU. So we do invite those lecturers to be our associate lecturer in terms of they will teach our students when it comes to modern science module. So I think we mentioned earlier, Mr. Seng and me also mentioned that we are actually a Chinese medicines program that has integrations with Western medicines. So we are actually invited those lecturers who are experienced from the relevant programs to actually taught our students. So that is actually one of our strengths if you learn Chinese medicines in IMU. And I would also like to share with everyone, of course, Mr. Seng has mentioned just now. So the GTP, so it sounds like some foreign language when we mention GTP, but it's in short, it is actually graduate trainee programs. It is actually just launched last year, 2023. So for Chinese medicines program itself, we have actually incorporated with a few companies. So probably you have heard of it, probably you may not, but if you're interested, feel free to find out more. Like for example, C Groups, which is one of the famous company clinic who provide fertility treatments. For example, My TCM and acupuncture. For example, Han Neuro. For example, Nature Concept, Nourish Tech. So all of them are basically our GDP partner. So when we mention GDP partner, what we mean is that they are actually signing a contract with us, meaning when we have a certain attachment for students as early as in year 2, if you are agreed to have a contract with this GTP partner, whenever the programs it's fulfilling the needs, so we will send you there so that you can actually start your attachment as early as possible at your GTP at the GTP partner. So of course, like what Mr. Seng mentions, like you have to work hard, you have to gain their their confidence. So if they think you are good enough, they can immediately take you in as their workers. So you basically work for them. So in short, you grabbed your working opportunity while you studying. So this is something that IMU have just launched last year, and I believe it is actually one of the strengths in terms of study Chinese medicines in IMU. All right. Is there anything that Mr. Seng you would like to add on?
I think it is very comprehensive from Ms. Goh. I think the GTP is a very good initiative, right? I think it secures. I think a lot of people they scared of job securing, so I think that secure a job early is good, right? So but the prerequisite is you must be good enough, right? You must be good enough. So that comes into your own initiative, right?
All right. Then we will explain, we answer the another questions. Yeah. So the another question is, how is the credit transfer program? Can briefly explain for it. Would it also provide scholarships? So Mr. Seng, would you like to explain for this?
Credit transfer program. Okay, I think we mentioned a bit there just now, but we went through very fast. In IMU, you can either do the local program or the credit transfer program. So both are 5 years, right? So if you do local, meaning that all 5 years is done in Malaysia in IMU, right? But if you do the partner school track, what happens here is that it's a 3+2 thing. So 3 years in IMU, 2 years in our partner school. So our partner school currently is Shanghai University of TCM and also is Shandong University of TCM. So currently these two are our partners, right? In the brochure, it has been mentioned there, right? So whether is there a scholarship for credit transfer? At the moment is no, because this scholarship, although IMU gives scholarships, but it gives the student who study in local. So if you're good enough, if you take the local program, you can apply for scholarship. Because if you do a credit transfer, the certificate that you will be getting is the credit transfer partner one. So it's not so fair for IMU to pay you that scholarship and then you get another university's certificate. That doesn't sound very correct. So therefore, if you are talking about partner or credit transfer program, there's no scholarship by IMU unless you secure a scholarship outside. If you get someone else to sponsor you, let's say some organization, that's a different story. But IMU is no. The answer is no. In short, it's no.
All right. Thank you, Mr. Sung, for answering the questions. Then we go to the next questions. Does IMU got internship in big hospital? So I think we'll take these questions.
Okay.
In terms of big hospital, we do have internship at a different clinic. We do have internship at hospital, for example, like Tengshin. All right. And we are currently exploring more attachment at other hospital. For example, like Selayang Hospital. Of course, we will have to work in and then to see whether is it feasible to allow our students to actually have attachment or internship over there. So the point is that most of the times, how we do things is we will make sure that the placement it's actually suitable for our students. Whether is it qualified, whether is it suitable to provide a good teaching environment for our students. So therefore, it takes time for us to work for it. But for instance, right now, we do have a lot of clinic that it's taking in Chinese medicine students for attachment. For example, those GDP that I mentioned, all right, of course, including Tongshin, all right. There are many, many more clinic that we are actually establishing right now. So I hope I do answer this question in terms of whether IMU got internship in a hospital. All right. We will go to the next questions. Someone was asking, why is the program duration is 5 years now? Last time my cousin studied it, it's for 4 years only. Probably you have to born a few years earlier lah. Huh? Just kidding, right? But I pass it to you, Mr. Sung, to answer this question.
Can. Also, your cousin studied in IMU before, so you can come in also lah. All right. Anyway, jokes aside lah. But then the program has been revised to 5 years. It used to be 4.5 years. Right. 4 years wasn't very correct. It was originally from the very beginning. I think when the program started in 2011, it was marketed as 4 years. But then after checking, I think there wasn't enough of clinical hours, so it was revised to 4.5 years. But since last year, we've totally revised it to 5 years. So from now on, it's always 5 years. This is actually something that's been done by the government because government, like I've mentioned, right, government put a bit of effort to actually standardize and regulate things. So it has been confirmed that in Malaysia, all Chinese medicine program has to be at least 5 years. So from now on, IMU has been moved on to 5 years from now on. Unfortunately, if you want it fast, but cannot fast, it's 5 years, right? It has to be 5 years now, right? So across all universities that offer Chinese medicine in Malaysia, is 5 years. So that's the standard that has been set right now.
Okay, thank you, Mr. Sung. We'll move on into the next question. This is a very interesting question. The question is, will I be called doctor if I study Chinese medicines? This is a common question that we always receive as well. I'll take in these questions. Of course, we do take ourselves as doctor in terms of because we do treat patients, we provide the similar modality, the treatment modality to the patients. And, you know, so sometimes when we look at how they address the Western's doctor, it's by using the name doctor. However, the way of the law itself in Malaysia is slightly different compared to other countries, probably. If you studied and you have a PhD level, then you will be able to call yourself as a doctor. If not, most of the times we will just call ourselves as a practitioner instead of doctor. Probably this question will raise because, you know, the words that we keep on using during our presentation was practitioner. So most of the times we are not allowed to call ourselves as doctor as the requirement from Malaysia, unless you hold a PhD. All right. I hope I answer your questions. Right. Now we move on into the next questions. Thank you for all the questions. There was a lot of questions that we need to answer. Right. Probably we'll ask Mr. Sung to answer this. Will I be able to study master program if I finish my TCM bachelor from overseas, for example, New Zealand?
Oh, okay. I think this master's program should be targeted to our Masters of Acupuncture program. I'm assuming that is the Master of Acupuncture program. If I assume it wrongly, you could just put into the Q&A again, then we will correct that. But let's assume on the Master of Acupuncture program, if you finish your Bachelor of TCM, let's say from New Zealand, I believe that we should be able to take you in. But to be very sure, I think we still need to check back with our admissions, right? So if I'm not mistaken, it should be okay. But let's be very, very sure. So let's better check it again. So my understanding here is that as long as this bachelor certificate is being certified and it's being recognized in Malaysia, it should be able to be registered, right? So that means that you can register for our master's program, right? But if really not sure, I think you either call to IMU or you put in an email to inquire. So you go to the inquiry at imu.edu.my, just email them, and then they should be able to assist you on that.
Okay, thank you, Mr. Sung. Now move on into the next questions. Someone was asking, seems like IMU teaching language just only in English. Would it be difficult for a Chinese speaker to learn it? Now I have to put myself into the shoe and share everyone my story, you know, old story again. I'm actually not from English school. Mandarin is my first language. Mandarin is my mother tongue. So I come from UEC. So I'm from a Tuzhong basically. So I speak Mandarin most of the times before I join IMU. As I mentioned, I'm also an IMU alumni. So definitely there are some challenges when you first switch from your mother tongue, which is Mandarin, to English. However, if I can do it, you can do it. Right. The fact is that most of us, the lecturer in IMU, are able to speak Mandarin. So most of us are local Malaysia Chinese, and we do have a professor from China. So all of us are able to speak Chinese to assist, and it shouldn't be an issue if your first language or your mother tongue is actually in Chinese. And we should actually take it in as an learning opportunity, because when you learn Chinese medicines in English, we are actually making it we are stepping into a bigger field in terms of more international. We are internationalize the Chinese medicines, and it is also a benefit for you in the future to work overseas, not just in Malaysia, not just in China. It is advantageous actually for you to work overseas. Like instant, for example, our gradient, some of them actually attach or doing the credit transfer to Australia. So they basically settle down themselves at Australia. And because the language that they learn Chinese medicines is in English, so it has turned out a benefit for them when they actually communicate with the patient, when they actually settle themselves down at Australia. So don't take it as a challenges. It is definitely a challenges, but we should take it as an opportunity to actually learn Chinese medicines in English, as well as supporting by Mandarin, the Chinese. I hope I answers your questions. Now I got to bring up another questions. So someone asked, if I finish my course in my partner university, can I come back and work as Chinese medicines practitioner in IMU? So I'm going to hand this question to Mr. Sung.
Okay, Ken. Very interesting question. That means either you finish your course in partner, that means you did the 3 years in IMU lah. I suppose that should be the question to it lah. You did your 3 years in IMU, and somehow probably you go to Shanghai or Shandong, our partner universities, and finish up, and you get a certificate from them. right? Can you come back? Always welcome. We always welcome our alumni to come back. That's number one, right? But another factor that we want to consider here is number one, is there any vacancies or not, right? So similarly, I think if you go to a place to ask for a job, right? So regardless of any clinics, so will they hire you? It depends on whether do they have vacancy, are they expanding or not. So currently, what I can tell you is you can try, but if so happen there's a vacancy and they're expanding, the ICMC, the IMU Chinese Medicine Centers expanding, then they will hire you, right? So I think it fits more of whether IMU would need such qualification people to come in more, because sometimes they might want to hire more senior people. So it depends. So I cannot tell you an exact answer, but what I can tell you is you can try, and we accept alumni. We always welcome alumni to come back, right? So if you ever is on that route, right, then welcome back to IMU, right?
All right, thank you, Mr. Sung. Probably to put these questions in a broader sense is that if someone actually finished the course in the partner university, can they come back and work as a Chinese medicine practitioner in Malaysia? So it will always go back to what Mr. Sung has shared. It's whether Malaysia has actually recognized this university. So as long as you're able to find the list of the university on the website itself, it is being recognized by Malaysia, it's always no issue for you to come back and work in Malaysia. So it doesn't matter whether you finish or complete your course at overseas, then you're worried that your certificate cannot be applied, cannot work in Malaysia. Can always go to the website and check, and to ensure that your university is actually being recognized by Malaysia. All right. We will take in the last questions due to time constraint. Probably we'll hand it back to Mr. Sung for these questions. Is that, will I have the mobility or exchange chances if I take Chinese medicines program in IMU?
Will I have a mobility? Come again, sorry, Miss Go, what's the question again? Mobility?
Yes, will I have the mobility or exchange chances if I take the Chinese medicines program in IMU?
Oh, okay. Of course, there is such an opportunity, right? So when we talk about mobility or exchange, just what do we mean by that is that you're not doing the partner university track. Likely you are doing the local track in IMU. However, you were just asking about whether will I be posted to external, right, or exchange program for, let's say, 3 months, right, for example. So in the 5-year program, if you read it in detail, right, you can always go to the website, look for IMU Chinese Medicine. You download the brochure. If you look at semester 9, there's a part where they call as supervised clinical practice 1. So at that particular part, that is where you actually observe and learn, right? So remember just now I spoke about where you have a 6 months to do real patient practice. That's supervised clinical practice 2. So that is on real hands-on practice. But if you talk about observation, you can always apply to do it elsewhere, right? So elsewhere means that it could be either locally or internationally, right? So we are currently working in terms of working with our partner universities that, let's say that you do a 5-year program in IMU, and in semester 9, you wish to, let's say, go to Shanghai. We can arrange that for you. So but of course the fees probably will increase a bit because of you're going externally, and then you have to pay extra, and of course your flight ticket, accommodation, that has to be bared by yourself. But then one thing very importantly here is that all these clinical sites are evaluated and also ascertained by IMU, right? So it's actually, most of them are our partners, right? And we actually evaluate them and feel that they are suitable for you to go and learn new things, right? So additionally, besides this particular semester 9, usually there might be certain universities that offer us certain opportunities to do summer school program. For example, like Shanghai University of TCM, usually in the month of June to July, they will have something called as the summer school program. So because we are one of their partners, usually they will offer certain slots to us, and sometimes they provide scholarships, right? So this one is based on some criteria now. But of course, if you're in IMU and you want to tap on these kind of opportunities, you can just look out for those opportunities when we announce it. But in short, I think semester 9, it's definitely a fair chance for anyone to go. If you want, you can apply. But of course, the fees wise will have to top up a bit. Have to top up a bit because since it's international exchange and things like that. Right?
All right. Thank you, Mr. Sung, for answering the questions. I see there are still more and more questions coming in. Thank you for the interest, for understand more about Chinese medicines in IMU. But due to time constraint, we won't be able to answer them, all of them one by one, and in details and things like that. So apologize for those questions that we won't be able to answer, but they are a website as shown in the screen. Always go to www.imu.edu.my to look up for more information about Chinese medicines program in IMU. If you have more questions, feel free to email us. The email address as shown in the screen itself. Don't forget that there is also an open day on the coming weekend, 18 August. If you're interested in Chinese medicine program, you can come and understand more from our faculty. So our lecturer, our faculty will be there during that day. So they'll be able to answer your questions and give you more insight about it. All right. I think that is it for today. And thank you everyone for your attentions. And we enjoy sharing all the information to you. And have a good night. Thank you.